becomes sick. And there's an incubation period, 10 days, probably no fever. Day number 8, day number 9, the person begins to show signs of fever. Is it Ebola? Is it malaria? Is it typhoid? Is it Lassa? We don't know for sure at that time, because the symptoms are fever, diarrhea, vomiting. And if you ask anybody what that means, they'll give you 10 different answers. It could be malaria, it could be typhoid, it could be Lassa, it could be dengue, it could be any number of things. So the importance of understanding who is connected to whom, that is a very important question. But before we explore this transmission process all the way back, we inevitably have to talk first about bats. And here's what's coming from CDC and others around the world who are studying bats. It looks as though bats are able to carry these viruses. It's not just Ebola virus, it's other viruses as well. Bats can carry rabies, bats can carry Marburg viruses. And it can happen in the following way. If people are living in these rural, remote locations, and there's already a problem with getting nutrition, people will eat the bats. You can see them when you go into the capital city at the markets. There are bats that they are cooked and they are consumed. And there's not much meat on a bat. But if you are hungry and you are needing the nutrition, bats become a possibility for consuming. In the jungle, in the remote areas, the first person who's eating that bat, not all bats, only 5% of the bats that we have sampled in these remote locations turn out to show evidence of having Ebola virus. They don't get sick. It's just 5%. The other 95%, with some variation according to season, the other 95% are perfectly, you can eat them all day long. You can't tell the difference between the 5% that are sick and the 95% that are healthy. So there is an opportunity that doesn't happen every day for transmission of this virus from a bat to a human. The other way it can happen is a bat can transmit to a monkey. And if the monkey becomes sick, it slows down, it develops a fever just like humans do, and a hunter will find it either dead or very sick or moving very slowly on the floor of the forest. And then that animal is taken, it's butchered, and the risk of transmission of the virus, if that monkey has Ebola, then the risk of transmission is very strong. But not every monkey has Ebola, not every act of butchering is going to produce infection. So keep that in mind. You have only 5% of the bats that are positive at any given time, and not every monkey is infectious. So, the transmission occurs within the family. The first person becomes infected with Ebola. What happens next? In the close contact, the touching, the cleaning up, the wife gets sick. So she is taking care of her partner. She's cleaning up after him. She's changing his clothes. She's removing his bedding and putting new bedding. She's wiping his face. She's cleaning up after him. The urine is infectious. The blood is infectious. The sweat is infectious. The feces are infectious. The saliva is infectious. The tears are infectious. The close contact is what creates the environment for transmission. And I don't mean close contact where you walk up and you touch like that. You don't touch like that and get infected. I emphasize, this is someone who is caring every day for someone who has a fever and is very sick. The wife becomes ill after a period of time. For the first days when she has become infected and there's no fever, she is not able to transmit virus to anybody. There is replication occurring in her immune system, in her body, but she is not able to transmit the virus to others. However, around the 8th day, or the 9th day, or the 10th day, somewhere in there, she can develop a fever. And then the same process begins all over again. The sister comes to take care of the wife, and she's wiping the sweat from her forehead. She's changing her clothes. She's changing the bedding of the sister that is sick. And then that sister becomes herself infected. So what I'm describing to you requires close, regular contact to sustain this chain of transmission. And if you think about this from the point of view of the virus, this is not an efficient way for the virus to make copies of itself. You've got the influenza virus goes far and wide all over the world. The influenza virus is always circulating on the planet. Ebola comes along every so often, creates an outbreak, and then disappears for a period of time. We see this in Uganda, it comes, it goes. We see this in DR Congo, it comes and it goes. And the point I wish to make by explaining this chain of transmission is that this is how we stop Ebola. When you know, when the health teams go into the community, they are going to be asking, this person was sick, with whom was he in contact before? Who are his relatives? When did he last have a meal? When did he last sleep at this place? Who was he in contact with? And this is all noted very carefully because we are looking to be able to predict who is going to get sick next. And if you can predict who is going to get sick next, you can pull them away from the contact with their family members. And when you pull them away from the contact with their family members, and they go to the hospital or to the clinic, and they're separated from the community, there is no more transmission. And there's few other diseases that work in this way. The healthcare workers they are saints, and they are putting their lives on the line to go into the community and to seek those who are ill. So they deserve an enormous amount of respect for the risk that they are taking. And I extend my thanks to them every day for the courage that they show. So understand, they have been having trouble, not only in Liberia, but also in Sierra Leone and also in Guinea, because the communities are fearful. And they are saying that when these people come to our village, and the other people who are coming from the West are coming as well, there's enormous suspicion in some cases that it takes a long, long time to work through the concerns of the community. And the community wants to protect itself. It wants to protect its families. It wants to protect the children. But in this case, with Ebola moving as it does, we don't have a lot of time. We can't afford to be extremely polite. We have to convince people, not with weapons or not with violence, but we have to convince them to open up the communities and not hide the sick people, not push them to some other place where they won't be discovered. That information is absolutely, absolutely essential to stopping this epidemic. You would like to think there could be a vaccine, and people are working on that, but it isn't here yet. You would like to think that there was some kind of pill that would simply stop the virus. It's not here yet. All we have is behavior change. We can say, protect yourselves by going early to the hospital and to the clinic. We can say, protect yourselves by allowing your loved ones to be taken care of in these places, if they work. So that's how it normally works. The other difficulty that we are facing in this fight, and this is where I appeal for your support, we are seeing hospitals where the staff is getting sick, they're becoming infected. They put on the proper clothing, but they have not the same familiarity with it, and so occasionally they are becoming infected. And when you see hospital staff becoming infected, you see them die, you see them, maybe they recover, but they leave the hospital, and the hospital is no longer a place where people go to get healthy. A hospital becomes a place that is a source of sickness itself. And that's a very, very, very troubling piece of this outbreak. And we at CDC are asking ourselves, how do we take care of this problem every day? If we can get a vaccine quickly, we should start giving that vaccine. what we are thinking at the moment is to give people the resources to do what we call home care of patients who are sick. But that's an enormous risk that you place upon those who are providing the care. So as I was describing with the sister who gives it to the sister, who gives it to the mother, who gives it to the husband, this is a very dangerous scenario when you have people in the home care setting taking care. Even if they're given gloves, they don't necessarily have the knowledge to protect. Yes, you can wash your hands, that's absolutely vital. Yes, you can use bleach to disinfect, but the trouble is it isn't a perfect solution. Once the hospitals, once Doctors Without Borders, you know them as MSF, or Médecins Sans Frontières, these guys are the other angels in this response. They're the ones who have the technology, but they're not, and they are delivering good health care, they are saving lives, but they aren't as close to people who need to be cared for. So for some people, it's only 1 county away. For some people, it's 3 and 4 counties away. It takes 8 hours. They're very sick. They might not make it. So MSF is every day telling us on the phone, we are taxed. We are overburdened. We are at the point of breaking. So we have to find a solution to work with this. So that's why at CDC we are pushing out probably another 50 people within the next month. Health communicators are part of that. I'm going back in another couple of days. And we're going to try to push these messages about people taking care of themselves, understanding this chain of transmission, understanding the importance of interrupting this chain of transmission. And if you have a role to play in this, you are affected. I know this, and the hearts are broken. And I don't want to see any more of this kind of suffering. Excuse me. So I'm relying and asking you to communicate what you've heard here. There's information on the CDC website. I hope that you will understand and put it into use. And if we break this chain of transmission, I think we're going to be successful. I'm looking at November, December, January of this year before that's really going to happen. So I have no further information to share with you. I care very much that the offer has been extended for me to come today, and I thank you for your time.